This conference will now be recorded.
Hello, my name is Dr. Safia Jabin, and I'm a lead trainer for MRCG overseas. And we run courses for training up, particularly for Part 3 MRCG. So today I'm here to give some idea about how we complete OSATs, for the competencies of the trainees. So before I start, I will strongly encourage all of you who are watching this video, please do subscribe to this channel first, because soon these videos will be available only to those who have prescribed the channels. It will be prescribers only. So please take a little gap and just press that red bell button of subscribe down and then start watching. Right, so I'm going to talk about how we complete OSATs for our trainees. So as you all are aware, OSATs is a structured way of assessing the technical skills for SD5. Is for every level, SD1, SD2, SD3. So there is a training matrix which states which skills these trainees should be competent before they can actually proceed to the next level. So OSATS stands for Objective Structured Assessment of Technical Skill, and I'm particularly going to talk about SD5 today in this session. So what are the expectations when we sign off some training? For level 3, which is also called independent competencies, any trainee who wants to get signed off, their trainee should be able to demonstrate the confidence to perform the clinical skill and completely and independently without direct supervision. So the consultant or the trainer is away from the hospital, out of the hospital. So in short words, the trainee should be able to perform that procedure confidently, competently, completely, and safely. The trainee is also ready to show the willingness to move on to experiential learning with further case exposure. So that means getting signed off from one competency doesn't mean the learning process is complete. So they need to show that willingness that they are happy to continue to learn from new case exposures. And it is also called experiential learning, is also called reflection on what to do as they perform their procedure. The trainee should be able to demonstrate a willingness to keep record of the number of procedures. So there is a certain number of procedures. They need to keep log of certain procedures throughout their training process to show any of the complications of the procedure and what they did to resolve it, so that the complexity of the procedures can also be assessed. So the competency means the competency is the baseline for safe, independent practice. So I have underlined this particular line here, baseline level for safe, independent practice. So we will come back to that at the end of this assessment, why particularly I have underlined this. Okay, so right, and how to undertake an OSAT. So all these instructions are basically for the trainees. These are the instructions like how they should be ready and what is the process to undertake the OSATs. So for the trainees, when they are ready to undertake an OSATs, they go and meet with their clinical supervisor and request them for this assessment. And the supervisor will then assess the procedure, will directly see them to perform that procedure, and then we'll complete the OSAT forms on the e-portfolio. In exam, you will get obviously the routine we use e-portfolio, which is obviously accessible online, but in the examination, you will have the paper copy of the OSAT form in front of you, which you will complete. So I will show you that form later on as well as we go along this session later on. So after that, the assessor, usually the supervisor consultant, will record the date that each OSAT is signed off. And there will be one OSAT assessment for every procedure, the final OSAT assessment for every procedure. The trainee must declare in advance whether the OSAT is summative or formative. And there must always be a distinction between the two. They cannot be updated to a formative assessment that's gone well. So again, just after going through these prerequisites, I will show what is the difference between formative and summative. The trainee must involve at least 2 different assessors in the sign-off process, and that is important because this will actually exclude any risk of bias in the assessment. You know, sometimes if it's a subjective assessment, some trainees must be your favorite and you're happy to sign them off, or if there are any problems with some trainees, so their training and their assessment procedures should not be compromised. And for that reason, these assessments usually are completed by different assessors, at least two assessors. So the same assessor should not complete all the OSATs for different competencies. A consultant must undertake at least one of the assessments, and senior sign-off must be as specified in the training matrix. So the training matrices, which is actually accessible on the RCG website. So the training matrix actually is simply a detailed description of the training skills, what is required at what level. So this just simply says for ST1 what competencies they need to acquire, at ST2 level what competencies and what they need to require. And that also tells us about the level of who should be signing them off as well. Okay, so this is available on our RCG website. You can easily look into that. Not yet. Okay, so going back to our so then the trainees, when they have these different OSAT forms completed, they need to retain all OSAT forms in their e-portfolio, whether they were completed satisfactorily or not. And they are required for the education supervisor to review your progress. And the reason for that, whether they were successful OSATs completion or sign off or not, that needs to be kept in record is because the supervisor also needs to know how my trainee is actually progressing through the training program. And what can be the and if some trainee is actually not really is really struggling to achieve some competency, then it's trainer's responsibility to find out and work with that trainee to find out what actually is making it difficult for this trainee, what barriers and difficulties that particular trainee is having, and what can be done basically to make it easier and facilitate that trainee to be able to achieve those competencies. So to be signed off as a fully competent for independent practice, you need minimum of 3 satisfactorily completed summative OSATs per procedure. So there will be 3 different OSATs, and they need to be summative OSATs. So now I'll tell you what is the difference between the OSATs when we say formative OSAT and summative OSATs. So formative OSATs is again the form, proper objective assessment form, but there's a difference between the formative and the summative. So this one is called formative. Okay, so it says OSAT supervised learning event. So formative OSAT is completed when some trainee feels he or she is capable of doing this procedure, and she wants it to be assessed by different supervisors who can be their senior colleagues like your ST6, ST7, or even some consultant, even your supervisor. So different people needs to do this formative assessment for that trainee to supervise, see them performing, and if they're able to perform, give them feedback to tell yes they are doing very well and they are doing it so confidently and safely that they are ready, so they can give them feedback that you are ready actually to go for your summative assessment. So this formative assessment is again completed by at least 3-4 different assessors. And this needs to be, again, you need to tell the assessor beforehand that I want my formative assessment done. So say, for example, you're going to go do some cesarean section. So you can ask one of your senior S36 and S37 if they're there, or if your consultant is there, to ask them that you want them to assess you as your formative assessment. But that needs to be done beforehand. It's not like you just happen to do the cesarean section or whatever the skill you are going to be assessed, and that went very well, and at the end you just go and bring the form and tell to the consultant, by the way, you have seen it and you have told me it's very nice, I've done it nicely, can you sign it off for me now? So no, that's not the way. You must agree beforehand. Okay, so it gives you a little detail on the form itself. Again, they are available on the RCG form. So the formative tool designed to give feedback to the trainee about their performance in that particular procedure. Okay, so and then provide specific and constructive feedback to the trainee. So constructive feedback means you're not supposed to just say, well, you are not able to perform it very well, or you did it very well. So whatever your feedback going to give, you are supposed to give some comments and explain as well why you think it was a successful, or it was a good procedure, or it was a good way that the trainee has performed the procedure. And if you say, well, you didn't do this particular procedure, or the step of the procedure you didn't do particularly well, then you must tell the reason as well, why and what particularly make you to feel that. So it's not only you just say, no, you didn't perform well, or yes, you did it very well. No, these yes or no statements are not taken. You must give the reasoning behind it as well. So the assessment of what elements are you going to assess, they are same basically. They will be same for the formative, and you will see the same assessment criteria on your symmetry form as well. So let's talk about the cesarean section. This particular ST5 wants to get signed up for cesarean infection. So this is the formative assessment beforehand. So you will be talking and giving comments on each of these individual steps. So checking equipment and environment, perioperative planning and positioning. So this all is, when you guys are talking about in your bylaws, and this is we will check WHO checklist. So this is what the WHO checklist is. Like, you are making sure your scrub nurse has opened the right equipment, environment, the temperature of your theater or the temperature, whatever, and everything, even the number of staff you need to have around, whether the relative should be there or not. So that all collectively is called environment. Has the patient been informed properly? What are you going to do? Then perioperative planning, for example, positioning. So what position you're going to do that particular procedure? You want a lithotomy position, you want a supine position, what particular position you are going to talk about. And then technical ability. So technical ability is obviously self-explanatory. Is your technical ability about that particular procedure, how you perform selection of instruments and equipment, whether you chose the right instruments. Economy of movement. So economy of movement is very important. That means your efficiency, time management to perform that procedure. So you're not expected to rush through the procedure. You're not expected to be so slow to the level that, the patient is, although slowly bleeding, the patient is bleeding and losing so much of blood. So there should be, like, some very safe range of your movement where you are efficient and quick enough to complete their procedure safely and properly. So it's not like you don't get appreciated if you are doing some procedure very quickly, say performing a cesarean section 10 to 15 minutes, or just some simple state for procedures, you're lingering on it more than 1 hour or something like that. So that is about the economy of the movement. Your tissue handling, whether you had been a very safe and gentle tissue handler, or you were just very rough poking and pulling this, all the peritoneum on the tissues. So that's very important as well. Completion of the task as appropriate. So have you been able to actually complete that task as it was required? So completion of task does not necessarily mean that whether the procedure during the procedure time goes wrong. Say, for example, we stick to our scenario, like we are assessing this particular ST5 for cesarean section stage 2. So at full dilatation. So so what is expected? Yes, there is a need of a little bit of extra skill to deliver the baby when the head is so down in the pelvis. But it is not expected that for some reason, if the patient starts bleeding quite heavily, there is some extension of tear or some PPH, it's not expected that you must complete it yourself. Your supervisor or the consultant who is actually observing and assessing you that procedure can complete those difficult steps in between. And then you can carry on with the rest of the procedure and you still can be signed off. So the skill here which will be assessed will be that you are able to basically ask your consultant to take over if they were you felt this was getting beyond your skills and it can compromise the safety of the patient. Communication with patients and relatives, so that to the patients, counseling them, any questions from them, asking, giving the answers to their relatives, and in after the operation as well, to explain them how your procedure went and if there is any aftercare required. Use of assistant, did you use your assistants very well, and your rest of the team. Communication with the staff is self-explanatory as well. Forward planning. So forward planning is again like if you are doing some complicated surgery, if you're going to do some procedure and you're expecting something, the main common complication that it can happen, then did you plan beforehand? Say for example, again, sticking to our cesarean section, late second stage cesarean section, obviously this patient can have will be high risk of going into PPH when the fetal head is really down. Particularly after failing to menstrual delivery, there is a risk when you're trying to disengage the baby head. There can be extension to the incision of the uterus. So beforehand, having that planning that you're gonna give the baby an initiator, you're going to check the uterine incision, unclamp the corners to make sure there's no extension and the patient doesn't bleed heavily. And you're expecting that this patient can go into PPH because of the attorney. So if you're beforehand ready with your symptometry and 40 units syntocin on trip as well as a prophylactic to start as active management of the third stage rather than waiting for the PPH happen and then start planning, can we just attach the syntocin on infusion. So these all things come under, so they are part of your assessment. Dealing with problems or difficulties, as we discussed already, like if any complication happen, how you are going to deal with them yourself. Were you able to recognize up to what level you should try to manage this difficulty or this problem yourself, or many is the time that you actually give over to your supervisor or the consultant or the senior colleague who is assessing you to say, for the patient safety point of view, I would like you to take over. And then how you have completed your recommendation afterwards and safety considerations. So these are the individual prerequisites. These are the criteria you will be assessing, and you will be writing your comments in front of it. And then you will give the feedback. So the best way, so once you have completed this part, then you come up to the feedback. And even when you're completing this part, you need to involve your trainee as well. So whatever comments you give, you will ask the trainee as well how you feel about it. How did you handle the tissue? How did you feel about the time management? Like, say, for example, you have completed this in 30 minutes or 40 minutes. So how you feel about your time management? Are you satisfied that the economy of your time was really good and the economy of movement was really good for this particular procedure? So involve, it's not one-sided. It's not that trainee is just sitting in front of you on your disposal. No, you can do whatever you want. It's a mutual discussion and mutual agreement process. So you must involve your trainee as well. How you feel about it? I feel you have done it very nicely, or I feel you could do this way. So obviously involve the trainee. So that get covered under this feedback. So in feedback, again, always start, whether it's a teaching station or whenever you want to give a feedback, even outside your clinical environment, always give the positive feedback first. And the best way is, before actually you start talking and giving any comments, ask your trainee, ask the person you are providing that feedback to, ask that person, so how you feel, how did it go? So what you feel, what went really well in this procedure or in this particular skill or whatever the process was. So, and then you develop on the comments of the trainee. So the trainee start saying, well, I felt really confident to do this. I prepared for this. I spoke to my scrub nurse, I have spoken to the anesthetist, I did this, I think this was really good, I have done according to as is, you know, instructed by the guideline or whatever. Then you can build on that, but say, yes, I feel that was really good on your behalf, you did this step, or you did this and you did this. Yeah. And then obviously you can add up some of more your points as well. If you are particularly you feel that trainee has done particularly something really good and the trainee herself or himself hasn't mentioned about it, then you can add up that into what went well. And then comes the what could have gone better. The phrase I usually like to use is, instead of saying what could have gone better, I usually say to them, so is there anything you think could have been done in a different way or could have been done differently to make it even better? So because that is just like the, although we all get trained that we should take the feedback as a constructive feedback, but it's a human nature. We do feel a bit offended when we are told this thing didn't go well and you haven't done it right or whatever. So be very careful when you choose the phrases and the words when you want to tell them how to improve it. So the best way to start is like either you can say what could have gone better, or what you think what could have been done differently to make it go even better. So then obviously give time to your trainee again. Don't just start straight away yourself by telling you could do this and you didn't do this and do this. No, just ask the trainee first because it's his or her reflection on the procedure. Yeah, so that's the OSAT is. They need to do the reflective on what they need to think themselves as well. What actually went very good, what could have been done even better. So then the trainee can, you know, tell you the points like I could do this, or I feel this could have been done this way, and if I would have, you know, planned this beforehand, or if I would have done this, that could make some difference. And then you can again build upon those phrases by saying, yes, I feel, you know, when these patients say, for example, when these patients started bleeding, whatever, you know, heavy or whatever, yes, you could just, you know, expect that beforehand, before the surgery, could have been. So I'm not particularly talking about serious section here. No, it can be anything, myomectomy or anything. It could have been better if we could have the, you know, if you would have made sure that the cross mesh blood is available and these, you know, whatever the relevant is to that particular procedure. So this is also you give those feedbacks, and then at the end again, you know, so you're not obliged at the same time. Try to maintain a balance. When we say don't use the negative words when you're giving negative feedback, or when you want to tell them how you could have done better, when we say don't use the phrases and the words which can hurt the trainee, at the same time, that does not mean that if something was not really safe and that needs to be improved, that doesn't mean that you don't say that, or you say that in a very obliged manner and in a very restrictive manner, just you're so afraid that the trainee may get upset. No, you need to have an assertive tone there. So if that needs to be improved, you need to tell that this is important, you know, this should be done this way. And in future, you know, I hope you can keep that in mind, and in future you can plan this in a better way. So that improvement points must come very clearly, but just in a constructive way though. So we are continuing still with the formative assessment. So and then you can tell about the learning points here, the, you know, what the trainee needs to improve on, and then suggest the learning resources as well. Say, for example, RCG so-and-so guideline or NICE guideline or surgical skills codes or whatever you want to suggest for the future. And then that our discussion is written. Then you will read that the comments, and the trainee will read those comments as well. And if the trainee agrees with your comments, you will be writing them. Then the trainee will sign and you will sign as well with the date. And that trainee's reflection. So trainee's reflection means that's the trainee's personal note for him or her to for his or her memory for the future. You know, that this was the case I did. So kind of a very, very short summary about the procedure. The trainee will write down here to say this happened and these things went well, these things needed to be improved, and I did this, so that he can have some memory, you know, points over here, so that in future, when this particular trainee will have further, discussion of appraisal with the supervisor regarding progress in training, and they come to this particular this particular OSAT form, then the trainee should be able to, remember exactly what was the procedure, what happened, and what was the background of that procedure, the patient, everything. So that's what is reflection. Okay, so that's the formative. No, so say for example this formative assessment, when we were completing that went very well. Basically, I was quite happy. There were more positive. A few minor things which needs to be improved. I have given those suggestions, feedback, and then I have told the trainee thinking, but I think you are pretty good and competent in doing this. So you are almost ready for your summative assessment. So then trainee will have like at least 4 or 5 these formative assessments completed by different supervisors, by different assessors. So that they can be like, again, it's a true reflection of the assessment, and it's not biased, or it wasn't one of just by luck it went well, or just by bad luck that didn't go well. Yeah, so it needs to be 4 or 5 different assessment forms completed before that trainee will proceed for the summative assessment. So summative assessment, again, even summative assessments, he needs to get 3 summative assessments completed for that particular procedure. The summative assessment, so this one is OSATS assessment of performance. Yeah. So the previous one was the assessment of learning. So this one is assessment of performance. So this one is a more formal procedure. Okay. So the important, very important thing for this one and different for formative is, although in formative assessment, I also mentioned that the trainee needs to tell the assessor beforehand that I'm going to perform this procedure, and I will be thankful, grateful if you can actually assess me during that procedure and give me some feedback to improve. So in so in summative assessment, the trainee actually needs to take and agree date and time as well from the assessor, which can be supervisor consultant, it can be any other consultant. Yeah, and he needs to have 3 summative assessments completed for final sign-off of the competency, and that should be done by different assessors, at least 2 different assessors. So this bit here is very important. Encounter request in advance, yes or no. Then this one is self-explanatory, trainee's name, trainer name, procedure. So let's start, we do like salient section, second stage, clinical details and complexity. I will say about low to intermediate, so it's a failure of instrumental delivery, and then followed by salient section. And degree of difficulty, we can say from intermediate, about intermediate, STR year 5, grade is the grade of the assessor, so consultant, or if it's ST6 or ST5, and then date of the assessment. The rest of the form is about the same as we had the formative assessment. So just explain what that is. So this assessment is mandatory, summative tool designed to enable the judgment of surgical competency in this particular procedure, to provide specific constructive feedback to the trainee about this. So if you concentrate, it particularly say these 3 words with the feedback: specific, constructive, feedback. So specific means, again, on individual criteria, step by step, not overall just working on, well, yeah, I think you did it well and you're competent to do this, or you just say, oh well, it didn't go very well, so I'm not quite happy to sign you off. So instead of these type of comments are called subjective. So objective means specific on particular steps, and constructive, whatever you're saying, if you're saying it was good, then you tell as well why you felt it was good, what actually went really good. And if you're saying no, that you didn't perform this particular step very good, then you must tell as well what and why and how that can be improved. Okay, so right then, so and then what happens? So it says there, so trainees require a minimum of 3 procedures deemed competent per core procedure by more than 1 assessor, including a consultant. There must be at least 1 consultant or post-CCT holder. This judgment is specific to this assessment only. Yeah, so that particular procedure only. Right, and then once you have done, then you need to make sure, again, these few steps, the trainee was able to perform all aspects of the procedure safely and competently with no or minimal need for help, or in the context of an expectedly difficult case may have needed more assistance for the more difficult aspects of the procedure. As I have discussed earlier on as well, I've explained in the formative assessment that if during that procedure, the things actually go beyond the normal straightforward procedure, like the patient start bleeding heavily or something, this comes in your assessment as well, that you are able to basically, so you don't have to feel, well, because I'm getting assessed now, I must complete this procedure completely myself, and if I didn't, I won't be get signed up. No, if you do that, then you actually have failed to assess your limits where you should have actually called for asked for senior help. So that actually is a part of assessment. So you may have asked me actually to take over. I mean, if you don't, I will still take over if I feel it's not safe for you to continue here anyway. But that point will actually then make that particular trainee to fail that competency, because what I feel here now is that no, I can't actually allow this trainee to independently do these procedures, because this trainee actually fails when he should call for help and when he should take the help, so he can compromise the safety of the patient. For trainees considered to be working towards it will greatly be expected. Is considered to be worse competency. It feels like you to think, I know, rather than say you're still working towards competency, that the trainee requires significant help throughout or with the majority of steps. Or the trainee was unable to perform any of the necessary procedures to be safe and competent at this stage. Yeah. So as we said, for the competency to be signed, there were 3 steps, and one was that the trainee is able to perform the procedure completely, independently, and safely. Yeah. So if safely is this, if there was a need to actually get help from the senior, the trainee should have taken R. And not only the help, say for example, during the procedure, for any reason, the trainee started feeling really unwell, lightheaded or anything. So the trainee needs to recognize and tell the, this just is an example. So you should tell, well, I'm not really safe to continue with the work, so I have to leave because I'm not feeling very well. Instead, that the trainee goes on the floor, and then we know, right, okay, this person actually is feeling lightheaded or something. So that also comes in all these safety compromise and these type of things. Okay, so right, so according to, so before actually, so this is where you will actually sign. So here you need to basically give some comment. If you feel after doing the assessment of individual stuff, which will be on the other side of the page, we will do in a minute. So after that, there will be 2 of the options you have to, one of the options you have to choose. One is the trainee perform this observed procedure competently. In simple words, we're saying this trainee is competent to perform this procedure independently now. So we will keep this and delete this line, because we do this online, so we can delete. But in your case, when you're doing in the exam, you can put a straight line across. This trainee is working towards competency. So if it's a competent, keep the first line, delete that one. And if you after that feel no, not really, for whatever the reason, either you feel the trainee didn't actually perform the procedure completely, or the way it should have been done, or for any reason the trainee had some limitations to perform this procedure. He may be competent enough, but today maybe the person was unwell, has some injury or something, and that trainee was unable to actually express the exact, recommended procedure, the steps of the procedure. Then you will say, you're obviously not going to sign off that person. So you will say this trainee is working towards competence in this procedure, and you will delete this line. Okay, but I give you these comments. It's very important that your trainee agrees with these comments as well, whether he is happy with that or not. Not on your trainee agrees with that. So it's only your judgment. You write down some training notes. Situation happens, what you're supposed to do. So this was the objective. Stepwise assessment is same as discussed in our form as checking equipment. So each of every step of the procedure you need to comment. And the feedback is same again. So in the feedback, you will ask the trainee first what went well, and then add up your feedback. And after that, come to the things which needs to be improved. So then ask trainee, obviously, was there anything you think would have been done differently to make it even better? Or Even if the person is not going to sign off for the competency, then obviously you need to give a lot of feedback here then, like what could have gone better. Yeah. Then the learning plan. So even if the trainee is getting signed off and we feel this person is competent to perform the procedure, still the learning needs are always there. So you need to make some learning plan with that trainee, like to do more cases, observe more cases, and if there is any complexity, ask your seniors or read these guidelines, go to their particular codes. So put their learning plan here. And then on the back page you will do, and then the trainee, if you both agree, whatever you have written, your trainee is happy with that assessment outcome, then trainee will put the signatures here and the trainer will put the signatures here. So that's the thing. If everything goes okay, whether you have signed off the trainee or not, and your trainee is happy with the outcome. Okay, so just to show you, like, how will you say, so we were talking about emergency serial section. So the complexity of the procedure is late second stage emergency, LSCS, due to failure of instrumental delivery. And what happened during the procedure, but there was a small extension of your training session. Okay, this is your define the complexity. And this is the form we have just discussed, how you will complete it, each and every step. So feedback, just a bit more examples for you to just to be more precise, like, okay, how you can solve. So what went well? So your trainee says, yes, it was difficult procedure after the failed instrumental delivery, the head was really down, but still I managed to do that. And you picked up by saying, yeah, there was a competent assessment of difficult instrumental delivery assessment. So the trainee planned to do their trial in theatre with the backup preparation and consent for LSCS in case of failure. So this is pre-procedure planning and plan beforehand. Yeah. Confident surgical approach, good technique to disengage to deliver the low head. Prompt identification of extension of uterine and satisfactory hemostasis, and proactive approach to prevent risk of BPH and active management of third stage. Okay, so these are the points we both came to agreement after the discussion what went well. What could have been done better? So maybe, although she delivered, maybe safely with a little extension, but I feel, say, or whoever the trainees feel, I could disengage and push the head up in the pelvis following failed instrumental attempt. Or could ask experienced midwife or some other assistant to disengage and push the head up at the same time when you're trying to deliver from the top, and to actually disengage so that you don't, extension of the training extension. So standard one that you must say that, and this is not again the protocol, the guidelines you must do that. So it's just for the teaching purposes. And learning plan say to read the possible complications of cesarean sections for various indications and prepare personal list of pre-planned considerations of these sections. For example, when you're doing the cesarean section late second stage, if you're planning to breach cesarean section, you're going to do cesarean section for cord prolapse and due to the twins. So again, just be aware. Yeah, so it's a good time. We have signed you off for this one. Go and revise these as well. Go through these guidelines, any special considerations you need to take into account. So that's like kind of feedback and that plan. Okay, so then we said, no, what happened? So this is like all good, all went very well. We told this trainee, you need to actually, let me go back to the, okay, so yeah, so if everything goes well, whether you said this person is able to perform this procedure or not, if the trainee is in agreement with you, then fine, all ended happily, that's fine, that concludes your assessment and the meeting. But what if you feel this trainee, you're not really happy, you don't want to sign that person as a competent to perform that procedure, and you want to say this trainee is working towards competency in this procedure, but that trainee has a conflict with you and the trainee says, no, I have performed it very well, so I would like to be signed off, which can be different scenarios. So I will just take example from one of these previous recalls where, like, if the trainee has performed, like, the person is coming for the notch tying competency assessment, but the person was not able to perform it properly because the trainee has injury to the right hand, so he's trying to do it with the left hand. So even if the person is doing and was able to perform, make the knot by somehow in a right way, but still because it's not done in a standard way, it's not done in those recommended steps, obviously you won't be happy to sign it off. So, but the trainee says no, well, I was ready, and the trainee gets upset and gets angry when I'm not ready to be signed off. Now, what you need to do in that particular scenario. So then there is a procedure to follow, and that's called then conflict an agreement. Okay, so you feel you don't want to sign it off, but the trainee wants you to sign off. So first you need to explain the trainee nicely why you feel it's not safe. You need to then check as well why this trainee particularly is so upset. So you can ask actually to say, so is there any other reason? Would you like to talk to me or discuss with me? Is there anything which is upsetting you? Because otherwise there is enough time, we can assess you after so and so time, and I will make sure we provide you proper training and more supervision and help till then to become more, able to perform this procedure independently. But if the trainee is still not agreeing and still upset, then the second step it says, is anything else going on which is making you upset? Why are you so upset about not being signed up, particularly today? And that you're not ready to take any further time. If there is nothing, again, unless there is anything, trainee says, I have these problems at home, or I have these problems at work, I really need to get signed off and all these things, then obviously you need to address that issue as well to support that trainee if there is an issue. If not, and it's just like because not every trainee has the mind to get it signed off today, and that's why he or she wants you to sign it off, then you need to tell the trainee, well, no, I'm sorry, because you do not meet the prerequisite, which were 3 steps. When we said that before the training gets signed off, there are 3 things. He or she needs to okay, so these 3 points. Yeah, so then we need to talk about to say, no, these are the yeah, so expectations are the person was able to perform the procedure completely and competently. Yeah, with something about this safety. Let me go back. Yeah, so one thing here. So what we said, these 3 steps here, the ability and the confidence to perform the clinical skills. So that person has managed to do that skill to show you, well, I tied that knot, whatever the way. So you will say, okay, he might have done this one, but then we need to say, well, it's not done the way, the standard way should have been done. And then what does this trainee is now failing to show us? He's failing to show us the willingness to move on to experiential learning with further case exposure. This person is just, what he's wanting is signed off. This person actually don't have insight that how important it is for this person to learn the skill in a right way and be able to perform in a right way. So this trainee should be actually flexible and prepared and willing to basically take their feedback and say, yes, that's absolutely right. I would like to actually take more time to improve on that skill, and then I will arrange my appointment again. So if that person is not agreeing, when we're saying you need to work a little bit more on this skill, that means this person is failing us to show this skill here, willingness to move on and learning from experiential of further cases. So, and the other thing which this trainee is failing us to show is, this trainee needs to understand the competency doesn't only mean that you need to get signed up because that is required for your training. That is required for your logbook to be completed. That is required for you to move from year 5 to year 6. No, the competency is the baseline level for safe, independent practice. We cannot compromise the patient safety, right? So that person is actually then failing to show me these skills, which are essential in addition to the competency of that person to perform that particular procedure. So obviously that person doesn't qualify to be signed up. So I have to show him to say, it's important that I make sure when I sign you up that you are safe, you have done in a safe way, and you are willing actually to learn more. And if you are failing to agree with that, then I'm sorry, I cannot sign it off today for you. And then obviously you can offer that person to say, if you still feel, usually I say to them, I would like you to understand my position as well. I have the limitation of this. I need to make the responsibility to make sure that you have done this procedure in a safe manner. So I cannot do. So you need to be assertive. You don't need to keep saying, I'm sorry, I'm not, I know you're upset for that, but I can't really sign it off. No. At this level, you need to be assertive, because this trainee needs to develop this skill as well, that he should be able to take constructive feedback. He should be able to recognize, yes, I need more time to improve this particular skill. Okay. So you need to be assertive, obviously not rude, but assertive, say I can't. And then you will not actually sign the form. Okay. So when the trainee is not agreeing with you for any of these, you will leave actually. So this is called the assessment is abandoned. Okay. So there will be abandoned. So we're not going to actually sign anywhere. You will write some note here that this happened, you want this, and the trainee is not in agreement. And then this will be called conflict. So now you can offer to the trainee two options. The one is by saying that, as I feel, you should take more time and you should work towards the competency of this procedure. I can help you with these. You can offer further, resources to that training and the time, and offer the trainee to say, if you want, I can arrange this assessment soon again with you after so much time, and we can meet again. However, if you feel that you're not in agreement that you should work further towards your competency, then you can actually take this assessment for conflict resolution, and you can take this assessment to some other consultant, which he or she is supposed to get signed up by other two people anyway, because this needs to be done by 3 different assessors. So that's called conflict resolution. So then you will put that note, maybe you will write down that note here, and then you will put your signatures and time, and then you will tell to the trainee to say. So because sometimes what happens, the trainee is upset at the time being, but he might then reflect later on and feel, no, yes, fine, I will go towards, I will work more to improve this particular skill. So then you need to actually offer the trainee by saying, okay, so you take your time to reflect on this, and if you feel, no, you would rather like to go straight away to some other assessor, you can take this assessment, you can take by some other assessor. However, if you feel, yes, you're happy with, my plan today, today's discussion will not actually affect your further training or your assessment. So it was neutral, it's not going to be as a personal thing to be carried on. So it will not affect your right of getting proper training and your assessment, neutral assessment from me. So the trainee doesn't feel, upset and feel, if I go back to, no, I have to work with this consultant and I'm still going to remain under the training of this consultant. How is that going to work? So you need to reassure the trainee as well that this discussion is not going to affect our working relationship, your training right, or even if you come back for the further assessment with myself. Okay. So this is how you do your OSATs. Which I think will be quite helpful this type of scenarios if they come in your exams. So, I do run the courses as well for an hour upcoming from 3rd of June. That's 72 April. So this is about our courses. So we are known as MRCOG Overseas. And there are 3 courses I will be doing for May exam, and I do run my courses on 3 different days, one on Friday afternoon starting from 3 p.m. UK time, and the session lasts for 4 hours, 4 to 5 hours, and it's a module-wise training, so we cover all 14 modules, and you get about 63 plus stations in that one. Obviously, on individual modules, we do discuss about the important points and how they should be done in exam. So group 1 is starting on January 2020. The Friday group, this is all Friday. This is the Friday. This is also called Friday group. The 18th of January, and this will be on every Saturday morning, from 18th of January, Saturday morning, 10:30 a.m. UK time. And that's module by. So they are same courses, and running in 3 different groups is actually, and the third group will be on Sundays, every Sunday morning. So 1 session every Sunday, and it will start on 19th of January, 10:30 a.m. UK time. And the reason for running 3 parallel courses is, number 1, to give the candidates and the participants opportunity to choose the day which suits them better. So whichever the group you book in, you can actually join and come into any other group sessions. So for example, you have booked yourself into Friday group, but on that particular day, in some module, say the day when we are supposed to do maternal medicine, you're on duty and you were not able to attend that module, you can actually attend that module with the group 2. And not only if you have missed, you will be active participant in your original group, and I don't take more than 10 candidates, so there will be only 10 people. So all of you do active, as a participant, active participants, you will play stations, because it's important that you play the station and I assess you and see whether you are trained properly to go and ready for the exam. So you can still be listener in the other group, and even in the group 3. So you just keep listening and repeating so that you become really well versed and well trained by the time. So yeah, so 10 candidates only per group, because it's not like just like a course, it's a proper training program, and I get you prepared like a proper, you will be well aware of the system, how the things happen, and even if there is any unexpected situation and scenario, you will be able to very nicely handle that, and you will be just talking and behaving just like any SD5 trained in the country. So if you want to join any of these courses, our contact details are given here. So my number is UK number 4479 1324 1703. There's another number as well, 447471 479269. And for the people in Pakistan, if they want to have some local numbers, they are also given as well. Dr. Asmanahi 0321 955 3679, and Samina Sadia 0331 4343431. We have a Facebook page as well, mrcog.overseas. Our website is mrcog.overseas@gmail.com. We have a Twitter group as well, which is called MRCG Overseas. UK-based trainer Dr. Safia is that group to join, and obviously only 10 candidates per group. Right, so that's about the courses. So before I close up, just a reminder again, if you have not subscribed to this channel, please do so before you switch off this video, because soon we are going to make these videos available only to the subscribers. So if you don't want to miss upcoming sessions, then please make sure you subscribe it today. So that's all from MRCG Overseas today. Bye.